I did not have any symptoms. I was watching Wheel of Fortune and I could not say a word. And then Sharon mentioned about going out and I wouldn't respond. Yeah?
That's right. When our son got up there right away, he just says, "Dad, we're gonna go into the emergency room right now."
Howard came in, he was in the ER room, and I met him briefly, and all he could say was okay or yes, and nod.
Shortly after his arrival to the hospital, we had a high concern that he may have had a stroke, so we alerted our stroke team and called a stroke alert.
We got him in here and got immediate care. Everybody was really good.
Our nursing staff is able to initiate a stroke alert, so when a patient comes into the emergency department and the triage nurse assesses them, they have the ability to then say, "I think this patient's having a stroke, let's start the stroke alert process."
That also means consulting with our stroke neurologist so they can come in right away and evaluate the patient via our telestroke monitor, which is right there in the room with the patient, so they can give us recommendations on treatment immediately.
We're not only able to kind of help speed up the delivery of care by giving an expert opinion right there over the camera, we're also able to kind of help go and triage who would benefit from one of these more advanced therapies.
Having the stroke neurologist available right away has certainly improved how we handle strokes. I think it's just really expedited the process. Everything happens so much faster than it used to.
The national standard for giving IV alteplase is 60 minutes. Someone like Howard, because of the stroke alert process and nursing got the stroke alert initiated when he arrived, his door to drug time was 36 minutes.
I first met Howard the day after his stroke, and I was consulted because he was having some significant difficulty with communication.
When they would come in, they would ask me my name and birth date, and then I couldn't say it.
I could see he was frustrated, I could see he was emotional, and I just grabbed his hand and we sat together and I just looked him in the eye and told him that I promise this is going to get better.
I just felt comfortable that he was in good hands.
It's impressive. You're doing so well. You're doing so well.
Thank you. I'm a little nervous today, but overall I speak and nobody knows it, right? The difference.
They don't have to be taken down to the cities, to Minneapolis, to receive this care. They're still receiving excellent care, and they're able to stay right here at home for the most part.
Telestroke has brought expert care to our community.
We were just happy that we could be here and stay here. That meant a lot.
I think that this is another way that we're here for our patients and really trying to do what's right and what's the best care for our patients and our community.